Center of Balance Live. I'm Szenan from Center of Balance. Today, our topic is UTI prevention. How do you prevent UTI to happen? We're going to talk about this topic today. Now, first, I'm going to go to my Facebook to share this live video. So I want you to do the same with me, whether you are on the live video right now or you're watching the replay. So I'm going to show you as a watch party. Okay. If you're on Instagram, Facebook, YouTube, please give me a thumbs up and leave a comment down there and let me know where you're from and who are you. And say hi to me, please. Then the next thing is share this live video. Thank you very much. Hi, Jean, how are you? Thank you. Thank you for joining us. Right. I'm going to my personal Instagram, the personal account, my Instagram. Then I'm going to share this live video. Go to live. Yep, there you go. You're all here. Great. Claudio, how are you? Hello. Thank you for being here. Great. That's awesome. Well, let's start. We've been talking about UTI. We're talking about if you in acupuncturist and you miss the treatment of acupuncture strategy point for UTI, please, it was 2 days ago we talked about this topic. And if you want to rewatch again, it'll be all on my YouTube channel. It'll be easier to go to my YouTube channel because it goes day by day. So I'll put it on a playlist. You can go to the playlist and check out all the previous live video. Of course, you can get it on the you can watch it on Facebook, but it's a lot of information on Facebook. It's not as easy to find. You may be able to find it. We put it in the playlist as well. I'm not quite sure you can you know how to do it or not. But it's easier ways to the YouTube. Okay. All right. So everyone can take the following steps to help prevent UTI. So how do you prevent it? Okay. Drink 6 to 8 glasses of water daily. Why is that? Because UTI is causing from retention, the water retention in your bladder. Right. So if you pass it out, keep constantly drink more water into your bladder, so you have full bladder, and you go to toilet, so you help it to pass. You keep passing out water, and you actually wash out your bladder, wash out the kidney and everything, and wash out all the urinary tract to pass out the bacterial, virus, and fungi. Does it make sense? Right. Now, do not hold your urine for a long period of time. Well, in this stage, hi Veronica, how are you? So I know we all busy with work, right? So, well, I can hold my urine because I never have a urinary tract infection. But if you suffer from urinary tract infection, your work is busy, and please do not hold your urine for a long period. Why is that? Because if you suffer from UTI and that UTI may happen again because you hold your urine for a long time. Right. Of course, talk to your doctor about managing any urinary incontinence or difficulty fully empty your bladder. Some patients they have, some of you may have experienced it. You have difficulty to pass your urine. You talk to your doctor, but I'll give you another option. The best way is to find an acupuncturist. To find an acupuncturist, Chinese medicine doctor to help you if you're a patient. I've experienced to treat woman who has difficulty to pass urine and difficulty to empty urine, and they have urgency. I have experience successfully to treat leaky. A woman after baby, 9 out of 10, they can't hold the urine properly, and it will leak. All that I just mentioned, the above, can be treated with acupuncture and Chinese medicine, and the results are phenomenal. So I do suggest you, if you're a patient, if you suffer from those above, UTI, difficult to pass urine, difficult to empty, leaky problem, call us on 078467956. If you are a practitioner, if you want to learn how to needle all those things, now I have a webinar, which is Balance Method Acupuncture webinar, local balance, learn it step by step, and you know how to treat all disease. Whenever the disease comes, it doesn't matter whether you treated before or you haven't, you know the idea how to diagnose and how to make the diagnosis, and according to the diagnosis, you choose the meridian and you choose the point to treat it. Okay, and we have a group. I'll support you too. Right now, let's get to UTI. Now, UTI happen much more frequently in women than in men. Right? We talk about all this. The ratio is actually 8-1, which means this means that for every 8 women who have UTI, only 1 man does. Wow, this is huge difference, isn't it? That's right. Woman, if you're woman, to be honest, I did that in one video. I mentioned that I only have one patient in Maine who came to me for UTI, and the rest of it are women. This is the reality, right? Then now for menopause or post-menopause woman, pre-menopause or post-menopause woman, using typical or vagina estrogen prescribed by a doctor could make a difference in preventing UTI. That's another way to do it. Right? Now, if your doctor believes that intercourse is a factor of your recurrent UTI, they may recommend taking a preventive antibiotic after intercourse or long term. Now, this is a way that Western medicine do it, but there are other options. So one of the options is acupuncture. Now, acupuncture, put it that way, acupuncture, you get regular acupuncture if you have a recurrent UTI, right? And the causes from intercourse. What you're gonna do is get a regular acupuncture treatment. It can be once a week. It can be in the we normally work once a week and then cut it down to twice weekly and 3 times weekly and once a month. Then in the end, you maintain it once a month. Why is that? Because it could be due to your stress. It could be due to your other stuff like bring your immune system low. Now, what happened in here is if your immune system is low, your immune system can't fight with the bacteria. That is why you get recurrent UTI. Of course, in the Western medicine, we talk about long-term antibiotic. What happens if you take antibiotic every day, or you take it straight afterward? And some people take it straight out afterward. For long-term medication of antibiotics, it will ruin your stomach and spleen function. We have a lot of patients when they take antibiotics, they get bloating, upset the tummy, they get runny bowel motion, they get acid reflux, they start to get sick, and want to vomit. All the symptoms indicate that stomach and spleen function is getting low and low and low. So you don't want to take something, try to fix one thing, and it cause the other thing. It doesn't make sense. It doesn't make sense for me. I don't know about you. Right. So one other option that I provide to you is acupuncture. And the other thing is Chinese medicines. Chinese medicines. Now, apart from that, there are other options. Taking daily cranberry supplement. Cranberry supplement has been proved that is useful and effectively for UTI. Right? For UTI. Now, of course, doctor may suggest you using vagina probiotic as well. Okay, because it may help in the prevention of UTIs. Okay, some studies has actually suggest that using probiotic vagina it actually can decrease the occurrence and recurrence of UTIs by changing the bacteria found in the vagina. And mostly that's what I when I look at recurrent UTI, and the research show that recurrent UTI is the woman actually they get the urine culture, and every time the urine culture show that the bacteria is the same bacteria. It's the same bacteria. There is very high chance that recurrent UTI is in the same bacteria. It's not something different, you know. So, which means if you get same bacteria each time, every time, that means that your immune system can't fight with this kind of bacteria. And you try to use antibiotics for it, I won't suggest. I would say, well, hey, get your body immune system back to strong, then naturally your body will fight with the bacteria. Doesn't make sense. Right. So this is my suggestion. Acupuncture in Chinese medicine is another way that can prevent UTI. Now, what sort of my suggestion of acupuncture strategy? When it happens, when UTIs happen, then you follow the strategy that I showed you 2 days ago if you're an acupuncturist. Now, when it's maintenance treatment, there's no symptom, you can back to magical 8 or magical 8 plus 1 or magical 12, because those two, magical 8 and magical 12, are very good for improve your immune system. So you want to improve the immune system to fight with the bacteria. But when the UTI symptom appear, you need to change your strategy. This is how acupuncture strategy changing. You know, you make the decision when the condition change, you change the strategy. You no longer stay with the state of magical 12 or magical 8. Okay, although magical 12, magical 8, it can treat UTI symptoms as well. But if it doesn't work that way, then you change the strategy. Right. Stay awesome. I'll see you tomorrow. Thank you for all your joining here. Thank you. Switzerland. That's great. Hi, Eric. How are you? Right. Thank you very much. Hi, everyone.